He was 63 years old, retired, healthy, or so he thought. He'd noticed a few changes over the past year. He was waking up 2, 3, sometimes 4 times a night to urinate. His stream was weaker than it used to be. He felt like he never fully emptied his bladder. He was tired all the time, but he chalked it up to getting older. His wife urged him to see a doctor. He kept putting it off. He told himself it was just a normal part of aging. Men his age dealt with this stuff all the time. It was nothing serious. 18 months later, he sat in his urologist's office staring at a diagnosis he never expected. Stage 3 prostate cancer. The tumor had grown beyond the prostate gland. Treatment would be aggressive, radiation, hormone therapy, possible surgery. His chances of a full recovery were significantly lower than they would have been if he had come in just 12 months earlier. The signs had been there. His body had been sending him warnings for over a year. He had ignored every single one of them. This happens every single day across the United States. Prostate cancer is the most common cancer in American men after skin cancer. 1 in 8 men will be diagnosed with it in their lifetime. And yet most men either don't know the warning signs or choose to ignore them because they're embarrassed, because they think it's just aging, or because they're afraid of what the doctor might find. That fear costs lives. But here's what I need you to understand right now. Prostate cancer, when caught early, is one of the most treatable cancers that exists. The 5-year survival rate for localized prostate cancer, meaning cancer that hasn't spread beyond the prostate, is nearly 100%. When caught at stage 1 or stage 2, most men are fully cured. But when it spreads, when it reaches the lymph nodes, the bones, or other organs, survival drops dramatically. The difference between catching it early and catching it late is almost entirely determined by whether you recognize and act on the warning signs. Today, I'm going to give you the 8 warning signs that most men over 60 ignore, explain exactly what's happening inside your prostate, and show you what you can do right now to reverse the conditions that lead to prostate cancer. Stay with me until the very end, because I'm also going to reveal the specific lifestyle factors that have been shown in clinical studies to slow, stop, and in some cases reverse early-stage prostate abnormalities. This information could save your life. But first, you need to understand what the prostate is and why it becomes a problem as you age. The prostate is a small walnut-sized gland that sits just below your bladder and surrounds the urethra, the tube that carries urine and semen out of your body. Its job is to produce fluid that nourishes and protects sperm. When you're young, the prostate is roughly the size of a walnut. But as you age, particularly after 50, the prostate tends to grow. This growth can be benign, meaning non-cancerous, a condition called benign prostatic hyperplasia, or BPH, or it can be malignant, meaning cancerous. The critical issue is that both BPH and early-stage prostate cancer cause many of the same symptoms, and both are often dismissed by men as normal aging. Here's the difference. BPH can make you very uncomfortable and affect your quality of life, but it won't kill you. Prostate cancer, if ignored and allowed to spread, will. The warning signs are your body telling you to get checked before a treatable condition becomes a deadly one. Let's go through the 8 warning signs right now. Warning sign number 1, frequent urination, especially at night. If you're waking up more than once per night to urinate, your prostate is likely enlarged and pressing on your bladder. Medically, this is called nocturia. Occasional nighttime urination is normal, but waking up 2, 3, or 4 times every night is not. It means your bladder is never fully empty, and it's being compressed by a growing prostate. Most men dismiss this as drinking too much water before bed or just normal aging. It's not. It's your prostate telling you it needs attention. Warning sign number 2, weak or interrupted urine stream. If your urine stream is noticeably weaker than it used to be, or if it starts and stops instead of flowing steadily, the urethra is being compressed by your prostate. When the prostate grows, it tightens around the urethra like a fist squeezing a garden hose. This reduces flow. You may also notice that you have to strain or push to urinate, or that it takes a while for urination to start. These are not signs of dehydration or a kidney problem. They are signs of prostate enlargement that requires evaluation. Warning sign number 3, feeling like you can't fully empty your bladder. After you urinate, do you feel like there's still something left? Like your bladder is still partially full? This sensation of incomplete emptying is one of the most common and most ignored symptoms of prostate problems. When urine stays in your bladder instead of being fully evacuated, it creates a breeding ground for bacteria, leading to urinary tract infections. It also puts chronic pressure on your kidneys. Over time, this retained urine can cause kidney damage. And all the while, the underlying prostate problem is going unaddressed. Warning sign number 4, pain or burning sensation during urination. This symptom frightens men more than the others because it's clearly not normal. Pain or burning during urination can indicate prostatitis, which is inflammation of the prostate, sometimes caused by infection. Prostatitis itself is not cancer, but chronic inflammation in the prostate is one of the factors associated with increased prostate cancer risk. Pain during urination should never be ignored or self-treated with over-the-counter medications without a proper diagnosis. Warning sign number 5, blood in your urine or semen. This is the warning sign that most men find terrifying. And they should. Blood in urine, called hematuria, or blood in semen, called hematospermia, can have several causes. Kidney stones, infection, or injury are common benign causes. But in men over 60, blood in urine or semen must always be evaluated by a urologist immediately because it can indicate prostate cancer, bladder cancer, or kidney cancer. There is no safe reason to wait and see if it goes away on its own. If you see blood, you call your doctor that same day. Warning sign number 6, pain in the hips, lower back, or pelvis that doesn't go away. Most men attribute back pain and hip pain to arthritis, old injuries, or just getting older, and often that's exactly what it is. But persistent, unexplained pain in the lower back, hips, pelvis, or upper thighs in a man over 60 can be a sign that prostate cancer has spread to the bones. Bone metastasis is how prostate cancer most commonly spreads. When cancer cells reach the bones, they cause aching, deep pain that doesn't respond well to normal pain relievers and doesn't improve with rest. If you have persistent skeletal pain and you haven't been screened for prostate cancer, you need to be screened now. Warning sign number 7, erectile dysfunction that develops suddenly or worsens rapidly. Erectile dysfunction, or ED, becomes more common with age, and there are many causes including cardiovascular disease, diabetes, stress, and hormonal changes. But when ED develops rapidly in a man who previously had normal function, or when it's accompanied by any of the other warning signs on this list, it needs to be evaluated in the context of prostate health. The nerves that control erections run alongside the prostate gland. When the prostate is inflamed, infected, or cancerous, these nerves can be affected, causing sudden or worsening ED. Additionally, some prostate cancers produce hormonal changes that affect sexual function. Warning sign number 8, unexplained fatigue and significant unintentional weight loss. These are the warning signs that apply to many types of cancer, not just prostate cancer. When cancer is present and growing, your immune system is working overtime. It's consuming energy, nutrients, and resources to try to fight the abnormal cells. This creates profound fatigue, not the tired feeling of not sleeping well, but a deep bone-level exhaustion that sleep doesn't fix. Unintentional weight loss of 10 or more pounds without changes in diet or exercise is a red flag for cancer of any kind. In the context of prostate symptoms, these signs together demand immediate medical evaluation. Now, here's where this conversation shifts from warning to action. I told you at the beginning that prostate cancer caught early is nearly 100% survivable. And I told you that certain lifestyle factors can slow, stop, and in some cases reverse early-stage prostate abnormalities. Let me give you the evidence-based protocol that every man over 60 should follow right now. Step 1. Get a PSA test and digital rectal exam immediately if you haven't had one in the past year. PSA stands for prostate-specific antigen. It's a protein produced by the prostate gland, and elevated levels in the blood can indicate prostate problems, including cancer. The test is simple. It's a blood draw. It takes seconds. The American Cancer Society recommends that men at average risk begin discussing PSA screening with their doctor at age 50. Men with higher risk factors, including African American men and men with a first-degree relative diagnosed with prostate cancer before age 65, should begin discussions at age 40 to 45. If you're over 60 and you've never had a PSA test or haven't had one recently, call your doctor today. Step 2. Reduce inflammation through diet. Chronic inflammation is one of the most significant drivers of prostate cancer development and progression. The foods that cause the most inflammation are processed meats like hot dogs, bacon, and deli meats, fried foods, refined sugars, white bread, and refined carbohydrates, and excessive alcohol. Clinical studies have shown that men who consume high amounts of processed meat and refined carbohydrates have significantly higher rates of aggressive prostate cancer compared to men who eat a whole food diet. Start by eliminating or drastically reducing these inflammatory foods. Step 3. Increase your intake of lycopene. Lycopene is a powerful antioxidant found primarily in tomatoes, and it has been extensively studied for its protective effects on the prostate. Multiple studies have found that men with higher lycopene intake have lower rates of prostate cancer. The key is that cooked tomatoes, especially tomatoes cooked in olive oil, release significantly more bioavailable lycopene than raw tomatoes. Tomato sauce, crushed tomatoes, and tomato paste are excellent sources. Aim for cooked tomato products several times per week. Step 4. Add cruciferous vegetables to your daily diet. Broccoli, cauliflower, Brussels sprouts, cabbage, and kale contain compounds called sulforaphane and indole 3-carbinol that have been shown in laboratory and clinical studies to inhibit the growth of prostate cancer cells and promote their programmed death, a process called apoptosis. A large study from the Fred Hutchinson Cancer Research Center found that men who ate 3 or more servings of cruciferous vegetables per week had a 41% lower risk of prostate cancer compared to men who ate less than 1 serving per week. That is a dramatic reduction achievable simply through diet. Step 5. Maintain a healthy body weight and reduce visceral fat. Obesity, particularly visceral fat around the abdomen, increases levels of insulin, insulin-like growth factor, and inflammatory cytokines that promote prostate cancer growth and aggressiveness. Studies consistently show that obese men have higher rates of aggressive prostate cancer and worse outcomes after treatment. Losing even 5 to 10% of body weight through a combination of moderate calorie reduction and regular exercise significantly reduces these cancer-promoting hormones. Step 6. Exercise regularly, specifically with resistance training and aerobic exercise combined. A landmark study published in the Journal of Clinical Oncology followed over 2,700 men diagnosed with prostate cancer and found that those who engaged in vigorous exercise for 3 or more hours per week had a 61% lower risk of dying from prostate cancer compared to men who exercised less than 1 hour per week. Vigorous exercise includes brisk walking, jogging, cycling, swimming, and resistance training. The mechanism appears to involve reduced levels of insulin, testosterone, and inflammatory markers, all of which influence prostate cancer behavior. If you're not currently exercising, start with 30 minutes of brisk walking 5 days per week and add 2 days of light resistance training. Step 7. Optimize your vitamin D levels. Vitamin D deficiency is extraordinarily common in men over 60, especially those who spend limited time outdoors. Multiple epidemiological studies have found that men with low vitamin D levels have higher rates of aggressive prostate cancer and worse outcomes. Vitamin D receptors are found in prostate cells, and active vitamin D has been shown to inhibit prostate cancer cell growth in laboratory studies. Get your vitamin D level tested with a simple blood test called 25-hydroxyvitamin D. Optimal levels are between 40 and 60 nanograms per milliliter. If your levels are low, work with your doctor to supplement appropriately. Step 8. Reduce your exposure to environmental toxins. Studies have found associations between prostate cancer risk and exposure to certain pesticides, industrial chemicals like cadmium and arsenic, and hormone-disrupting compounds found in plastics such as BPA. These substances can mimic estrogen in the body, disrupt testosterone balance, and promote prostate cell proliferation. Practical steps include eating organic produce when possible for the most pesticide-heavy crops, avoiding heating food in plastic containers, filtering your drinking water, and choosing personal care products free from parabens and phthalates. Step 9. Manage stress and prioritize sleep. Chronic stress elevates cortisol, which suppresses immune function and creates a hormonal environment that favors cancer growth. Stress also elevates insulin and promotes inflammation. Men who sleep less than 6 hours per night have higher rates of aggressive prostate cancer compared to men who sleep 7 to 8 hours. Prioritize sleep by maintaining a consistent bedtime, keeping your bedroom cool and dark, and limiting screen exposure in the hour before bed. Address chronic stress through regular exercise, social connection, mindfulness practices, or professional support if needed. Step 10. Discuss medications and supplements with your doctor. Certain medications commonly prescribed to men over 60 may affect prostate health. Finasteride and dutasteride, medications used to treat BPH, have been studied as prostate cancer preventatives with mixed results. Statins, used to lower cholesterol, have shown some associations with reduced prostate cancer aggressiveness in epidemiological studies. Conversely, testosterone replacement therapy, while beneficial for men with clinically low testosterone, requires careful monitoring of PSA levels. Several supplements, including saw palmetto for BPH symptoms, green tea extract, and pomegranate extract, have shown promise in small studies but require more evidence. Never start or stop any medication or supplement regimen without discussing it with your doctor. Now let me address one of the most important points in this entire video. Men avoid prostate screenings and medical appointments at alarming rates. Studies show that men are significantly less likely than women to see a doctor for preventive care. They are more likely to minimize symptoms, delay seeking help, and avoid examinations they find uncomfortable or embarrassing. The digital rectal exam, where a doctor feels the prostate through the rectum, is particularly avoided. Many men would rather take their chances with cancer than experience 30 seconds of mild discomfort during a routine examination. I need you to hear this clearly, that 30 seconds of discomfort could save your life. The digital rectal exam takes less time than tying your shoes. It allows your doctor to feel whether the prostate is enlarged, hard, irregular, or tender, all of which are important clinical findings that blood tests alone can't detect. Your embarrassment is not worth your life. Your discomfort is not worth your life. Please get screened. Let me also address a common misconception about prostate cancer diagnosis. Many men believe that a prostate cancer diagnosis automatically means surgery, radiation, and a destroyed quality of life. For low-risk, slow-growing prostate cancers, an approach called active surveillance is often recommended. This means your doctor monitors the cancer closely with regular PSA tests, exams, and periodic biopsies, but doesn't treat it immediately. Many low-risk prostate cancers grow so slowly that they would never cause symptoms or death during a man's lifetime. Active surveillance avoids the side effects of unnecessary treatment while ensuring the cancer is watched carefully and treated if it shows signs of progression. The message I want you to take from this video is not fear. I want you to feel empowered. Prostate cancer is not a death sentence when caught early. The warning signs are real and recognizable. The lifestyle changes that reduce risk are achievable and backed by science. The screening tests are simple and available. Everything is on your side if you take action. If you're a man over 60 and you've been experiencing any of the 8 warning signs I described, make the appointment today, not next week, not after the holidays. Today. Call your primary care doctor or urologist and ask for a PSA test and prostate examination. If you're a woman watching this, share this video with every man you love, your husband, your father, your brother, your son. Men don't share this information with each other the way women do. Be the person who changes that. Your life is worth 30 seconds of discomfort and a blood draw. Take care of your prostate. Take care of yourself.